We welcome you on this new edition of Max Healthcare Facebook Live session. In this session, we will learn about the management of common health problems in senior citizens. Joining me in this session is Dr. Vijay Aroda, Senior Director, Internal Medicine, Max Super Speciality Hospital, Patparganj. Welcome, Doctor. Sir, before moving on to the management of problems in senior citizens, I'd like to ask a question about the common problems in elderly people. What are the most common problems in elderly people, sir?
Hi everyone. We encountered most of the problems specific to elderly. They are diabetes, hypertension, COPD, then chronic gut motility disorders like chronic constipation, then hearing disorders, then loss of vision, maybe because of cataract or glaucoma, and dementia, forgetfulness, depression, loneliness, and other behavioral disorders which are encountered in elderly people.
Moving on to next question, it is about how to take care of stress in senior citizens. So what can a caregiver do to reduce stress for senior citizens?
The responsibility of caregiver is to tell each and every elderly person that they should make a schedule and follow that schedule particularly, and they should do exercise daily, at least 20 minutes a day. They do some yoga, at least to make their body little more flexible so that the incidence of fall can be prevented, and walking minimum for 20 minutes per day is definitely going to help them.
So next question is related to dementia. You mentioned early in the first question amongst the most common problems. So what is dementia and what can be done to prevent this disease in senior citizens?
Dementia is a syndrome of progressively slow declining of the brain function, and most of the people, they confuse Alzheimer with dementia, although Alzheimer is a part of dementia, and along with the vascular part, it makes most of the part of dementia. And and how we can prevent dementia and what are the usual features which are seen in dementia. They are forgetfulness, they are loss of interest in the surroundings, then inability to speak properly, incoherent of word, use of incorrect words, and then difficulty in giving self-care is another part of dementia.
So people in this age suffer from diabetes, hypertension and arthritis mostly. So how can these diseases be managed?
The aim of control of diabetes in this age group is we should not allow any patient to develop hypoglycemia. That means blood sugar less than 50. So we should maintain a diabetic schedule where we prevent hypoglycemia, and at the same time we should prevent very high glucose levels, that is more than 180 levels. So the aim is to maintain HbA1c of between 7 to 7.5, and we should not stress more on very tight control on the diabetes. As far as a part of hypertension control is concerned, we should allow them to maintain a blood pressure of systolic between 140 to 150 and diastolic between 70 to 80, 85. And these are the elderly people, especially those who have already suffered from stroke or some renal insufficiency. So this much BP, we should not go beyond this. Anything which is above 150 systolic or more than 90 diastolic should be treated in all circumstances. And whatever is considered better for osteoarthritis, if you see people who are having osteoarthritis, they should have their home friendly to them so that they can walk on the smooth surface, and the surface should not be very slippery, and there should not be any problem of logging, and they should have some bars in the bathroom so that while getting up or while sitting on the toilet seat, they should not face any problem or they should not fall down.
Moving on to next question, it is related to depression. How does one know when elderly people are depressed? Is it different from depression in younger adults?
Yes, no. Then most of the people who are having dementia and those people who are having depression, this may not be similar to what we see in younger age group. As already told that every 1 in 14 people above the age of 65 will have type of or features of dementia in their lifetime, and the people above the age of 80, every 1 in 6 people are bound to develop features of dementia. As far as depression is concerned, it's one of the features, and we may not be having typical features of depression. The only thing is this increase in the symptoms of the patient, there is increase in the body aches and pains, and there is increase in forgetfulness, then difficulty in concentrating on the self-care, and not eating at time, not drinking adequate waters, or not taking bath. These are the features which are usually not seen in younger age group of patient having depression.
So we are left with the last 3 questions. Next question is about the fitness improving in older adults. So what measures can improve health and fitness in older adults?
The best is eating a healthy diet and taking adequate amount of waters every day, so that they don't go into dehydration and they should not fall because of orthostatic hypotension, which is a common phenomena in elderly age group, and especially people who are having Parkinson disease along with other feature of dementia. So the aim is healthy diet, daily walking, daily exercise, yoga, meditation, and deep breathing exercises. These are very small things which will help them keeping fit in this stressful life.
So second last question, what precautions can we take to avoid risk factors in senior citizens?
The risk factors is their home should be senior citizen friendly, they should be having adequate lighting, the curtain should not be drawn every time, and there should be contrast in the color, and there should be some garden where they can sit down and have a chat with the nature, and there should be some light music. They should indulge in something like cooking or singing or doing some stationary cycling or walking within the home. So these are the things which will help them. Again, I am laying stress that we should be having a bathrooms which are elderly friendly with adequate bars while standing or sitting down on the toilet seat, so that we can prevent the falls. Flooring should not be very slippery, and they should be elderly friendly.
Moving on to last question, how can we promote healthy aging?
Healthy aging in senior citizens, especially in elderly group, by telling them to have balanced, nutritious diet. They should maintain their weight, they should do physical activity, they should keep them socially active, and they should have adequate night sleep, and they should go for daily walk and exercise, and they should avoid substance abuse, they should avoid smoking or alcohol, and they should be in charge of their own attitude, so that they can, because which is the attitude is a state of mind. When we are in tune with our body and love and honor our body, which we cannot communicate with our enemies. So we should treat our body, we should love our body, and we should honor our body. Only then we will keep ourselves fit. As we do not communicate with enemies, we should not treat our body like an enemy.
Thank you so much, sir, for your time. I hope our viewers will benefit out of this wonderful session. If any viewers would like to ask question, they can put their question in the comment box. We'll try to answer as many questions as possible. Thank you.